welcome to EURACTIV's Health Podcast, where every week we dive into EU health policy and bring you the latest health news from Europe. I'm Giedra Peseckytė, a health journalist at EURACTIV, and for today's episode, I had the pleasure of speaking to Jens Lundgren, professor of infectious diseases at the University of Copenhagen in Denmark. He has been involved with clinical HIV research for the last 30 years, and for over a decade, he has been trying to develop better European standards for HIV testing. As this week is European Testing Week, a European campaign that aims to increase testing efforts and promote awareness of the benefits of earlier hepatitis and HIV testing, I'm talking with Lundgren about the importance of early diagnosis for HIV patients. For our listeners, I would like to highlight what he stressed at the end of our conversation. It is important to speak about testing strategies that include HIV, viral hepatitis, and other sexually transmitted diseases, as they all come together, rather than having testing strategies in silos for each disease. So, before further ado, let's jump into the interview. First of all, thank you very much for joining us today. To begin with, could you please tell me and our listeners what is the importance of early diagnosis and what it changes for the HIV patients?
Well, briefly, and we can maybe expand on this, but briefly, the reason is that if you get diagnosed early on after infection, you have substantially less risk of getting sick from your HIV disease. And the second one is that once you get on treatment, then your chance of submitting the virus to others becomes essentially eliminated. And therefore, you are protecting by getting yourself on treatment, those that you, in your social network, your sexual partners as well.
As it means also, in a way, kind of reduction of cases, I assume that it's better for healthcare systems and probably economically it's less cost as well, right?
Well, I mean, that's a natural consequence of that. HIV care is a lifelong entity, and therefore, once you are infected and on treatment, you will be on treatment for the remaining part of your life. And obviously, we want to have less patients in our hospitals. So if we can hopefully reduce the transmission burden, getting less people infected over time, that's good for those who are infected, who no longer, for those who's not infected but are at risk, right? So it's good for the individual, but it's obviously also good for society.
Yeah, of course. And we're talking about early diagnosis, but actually, what would be the early diagnosis and how is diagnosis classified?
So early diagnosis is essentially as quickly as possible. So this could be in the early weeks after the infection. Typically at that time, those who is just recently infected will have symptoms of acute HIV infection. So they will have potentially fever, they may have a rash, they may rash on the skin, a rash in their mouth. They may develop herpes zoster, for example, on their skin. But typically after that, the disease comes into a asymptomatic phase where you don't have symptoms. And then as you then progress, if you don't get on treatment, you may not feel a lot from the infection yourself. You may sometimes have a little bit of an infection, maybe more frequently than others, but for many people, they don't experience the disease until they start to contract a lot of different infections that they usually didn't have, including tuberculosis, so quite serious disease. But also, we can see that if you're left untreated, your risk of developing cancer is also elevated. And then we call that the more symptomatic case. It was previously called AIDS, but that becomes, we see that many other conditions that those who's part of the AIDS definition actually are seen with increased rate among untreated patients as the disease progresses.
I really wonder, from what you see, what is the situation now with testing within the European Union? And like, for example, when I was checking the numbers, it seemed that during COVID times, there were less cases of HIV. but probably it was just because the testing wasn't done as efficiently, right?
Well, I mean, the COVID pandemic was really a downswing on the efforts that was made, and the acceleration of testing throughout the continent. So the COVID was really not good for what we're talking about here. That is unfortunate, but obviously now things are settling down. As a consequence, we need to go back and refocus on making sure we get all those infected diagnosed.
Do you see any other issues or challenges when it comes to efficient testing and actually ensuring that people can be diagnosed early?
Well, first of all, I want to emphasize that if you look at the European continent, the way WHO identifies it, we just need to understand that the number of people we're talking about here that is not on treatment, that is where the virus is contained, that's a startling high number. It's over 800,000 people. So this is not a trivial number. So why has it not gone down further? And there is obviously a number of different explanations for that. And you can separate them into those who is determined by the individual. So who is actually seeking care, who's seeking testing. So that's one thing. So that's for the individual. But then, of course, there is the infrastructure of how testing is being provided. And this is typically governed by various testing strategies that each of the countries around the continent are implementing. And we can see that across the continent, although there are very robust continent-wide testing guidelines, that it is fairly unusual that they are comprehensively introduced in each of the countries across the continent. And that's, of course, unfortunate that we essentially know what to do, but we want to make sure that it actually is being done, and that each country take this on in a serious matter and uses the international sort of knowledge that we have and implement that knowledge within their country. So that's an important component of why this is not happening. It's not the only one, but it's one. I also want to recognize, in particular, depending on where you are in Europe, that HIV is still linked to stigmatization and discrimination. We need to also have a societal discussion around that having an HIV test is actually good and that those who happens to be infected, of course, they need to be handled like anybody else. It's not a disease that is deadly. As long as we get a good and comprehensive testing strategy in place. And I just wanted to maybe say a few more things. I mean, it's also about how the testing system have been set up. How easily accessible is it to get an HIV test? In the last couple of years, there's been a lot of research done around self-testing and self-sampling. So you can get a test not necessarily having to go to a health clinic, but you can do it elsewhere. That has been really successful where it was, so it becomes easily accessible for the population to get tested. So there's a lot of components here that needs to work together in order to get a comprehensive testing system in a given country.
Yeah, I think it's very important how people actually can access testing. And for example, I wonder. How is it like there are, of course, gaps among communities, how they can access testing? And is there approach or should there be an approach where healthcare kind of comes to the communities which are more at risk to provide the testing services?
Well, I mean, it's for sure. I agree. I mean, it's an old way of thinking that the population should always contact the health system. As you say, we need to reverse that thinking and make sure that health services that is important, that they become easily accessible and in the vicinity where people actually live. So it becomes a true an easy accessible option for people to take. And there's a lot of work to be done around sort of decentralizing testing, a lot of sort of evidence-based approaches for how that could be done. So we want to see more of those being actually implemented. So that's an important point.
You mentioned a very interesting point about self-testing. How is it now in the EU? Is it available in all countries, or is it becoming more popular?
I don't think self-testing or self-sampling is the way that most people should be tested, but it should be one possibility of getting an HIV test, because it's obviously something that you can then do in your own controlled environment. And it is getting more accessible, and it is possible to do now. But I would like to make sure that this opportunity, this possibility, is more widely accessible, because it is. I mean, for testing, it's really not one approach. It's a comprehensive profile of different approaches that needs to come together in order to identify people. Some people get access to testing if they go to their GP, general practitioners, and they're very comfortable with that. But others live different lives or have other issues that where they do not want to approach the general practitioner to get an HIV test. And they should have the possibility as well. So I think in different countries around Europe, we need to work more to make sure that we have this comprehensive profile of testing possibilities.
Also, people who need testing come from different backgrounds. There are migrants who might be not aware about how healthcare systems work. They are not registered. They don't know where to seek for help.
Importantly, when you say this, because people who is not sort of from the country, they don't really live in the country, I agree, they should still have the possibility of HIV testing. Of course, it raises some important issues around if the test comes out positive. Where can they get access to care, right? So there needs to be some thinking around this to make sure that people, when they are in the country, that they can also provide care. And the linkage between testing sites and care providers are established, so we make sure that those who actually happens to be identified as being infected, so HIV positive, that they can access care immediately. That's the whole point of the testing, obviously, is to get people on treatment.
Now, moving a bit away from the testing, one of the ways for prevention is also available medicine like PrEP and PEP. Do you feel that people know about this? Do they have enough access to these drugs?
Well, I mean, PrEP as an entity is used in many countries now, but you can always debate whether, quote unquote, the right people get access to PrEP. Because, I mean, obviously, the whole thinking around PrEP is that you identify completely healthy people that happens to have a lifestyle that makes them at risk of HIV. And that risk needs to be not trivial, but sort of reasonably sizable in order for PrEP to make sense. If that's the case, then they need to agree to take medicine to reduce the risk of getting actually HIV infected, right? So there's a lot of complicating steps in provision of PrEP. And where obviously the health system needs to be set up to make sure that this becomes accessible. We talked about getting access to that as locally as possible. But obviously it also requires something from those who actually takes the medicine or wants to get access to PrEP, that they need to feel comfortable around starting to take medicine without actually being infected for the purpose of avoiding getting infected. So I just want to recognize that there is two parties to make PrEP successful. But clearly this is accelerating. It has a good traction in many sort of subgroups of society, in particular among men who have sex with men, and is now widened that further out. But I think we're not still there where I think all those who is at risk actually get on PrEP for sure.
And when it comes to PEP, because I was following one of the conference and it was mainly focused about the situation in Ukraine. And there was an example of incidents of rape and how PEP could be a solution then.
Yeah, absolutely. I mean, that would be a very precise indication for using PrEP, for sure. Absolutely, that's an important. I mean, post-exposure prophylaxis makes sense. We use that in healthcare providers who get exposed to HIV, and obviously, as you say, people who is unfortunate and knew that they were in a situation where they may have had a risk of being infected, that they should start on PrEP. Importantly for PrEP, it's important to make sure you access a site who can provide PrEP quickly after the exposure. So preferably within the first 24 and certainly within the first 72 hours after the exposure.
For my last question, I think I would like to ask you, as you have a lot of experience in this field, how do you see throughout of your work, is the situation changing? Is it getting for better, especially regarding the early testing? And also looking forward, would you like to see more united European approach on how to tackle HIV, or you think that each country has more its own way of dealing with it?
Whether it's going in the right direction, I think that really depends on where in Europe we're talking about. There is in all three sort of larger sub-regions of Europe still a lot of people who is diagnosed with HIV. So no places in Europe you can say we don't have a problem with still people not being diagnosed. But it has improved. In certain countries, in particular in the western region of Europe, as access to testing has been more decentralized, as we talked about earlier. Elsewhere, it is not the same situation, unfortunately, and as a consequence, a fairly sizable proportion of those who get diagnosed are diagnosed late in the course of their infection, what we call late presenters. Both the European Centre of Disease Control and WHO Europe have comprehensive testing strategies, evidence-based and with all the different documentation required. That being said, however, maybe sometimes forgotten, but health policy is a individual country decision. It's not something that Europe as a continent can decide. You should do this and you should do that. You can encourage, you can motivate, you can say this would be in your best interest, but in the end of the day, it is a decision that each country's authorities, public health authorities, and civil society needs to make decisions on. My view is clear. I would like to see more comprehensive testing along the lines of what these guidelines are recommending. I would want to make sure we continue to discuss this, so we continue to improve access to HIV care testing, and to make sure that those who is positive get access to HIV care. That's the fundamental focus that we should continue to focus on throughout the continent. But there's a lot of people who needs to be involved with this, and there certainly needs to be a political will with each of the countries, because they are responsible for implementing to make sure that it actually happens.
Thank you so much, Jens, for sharing your insights. It's really very valuable. Maybe I haven't asked you something that you think it's very important to mention. Then please go ahead.
Well, one last thing, if I can indulge you, is that we have now talked about HIV for the last several minutes. I just want to remind that HIV, viral hepatitis, sexual transmitted diseases, they all come together, not completely, but they all come together. So one final point for me would be, let's make sure we don't discuss these testing strategies in silo for each disease, but actually look at how we develop a comprehensive testing strategy that covers all the diseases I just mentioned here. It would benefit the overall public health if we think across the different diseases and just not one.
That's a very important point, and thank you so much for raising it. And it's a nice note to end the podcast. So thank you very much, Jens. If you are enjoying listening to EURACTIV's Health Podcast, a friendly reminder that you can subscribe to our newsletter that comes out every Wednesday, the same weekday as our podcast. We will make sure to keep you up to date on the main EU health news. And don't forget to check other EURACTIV's podcasts as AgriFood Brief, Tech Brief, and Beyond the Byline. That is all from us today. Thank you for listening. We also want to hear from you, so if you have something to say, don't hesitate to drop us a line. Our email address is podcast@euractiv.com, or contact us on Twitter or LinkedIn. This episode was brought to you thanks to our multimedia team, so special thanks to them and one and only Jonas Hellebuck. Until next Wednesday, stay healthy.